Yes. Clinic. Setting is clinic. Yeah, you have your role play card here. So we are going to practice. Hello and welcome to Seven Sentinels. This is Grandmaster Class and I'm Peter Simon with you. And today we are going to take a speaking session for Jancy Thomas from Muscat, Oman. Yes, Jancy, you can start.
Good morning.
Good morning, nurse.
I am Jancy, one of the registered nurses in this clinic. Please be seated.
Thank you very much, nurse.
How can I address you?
You can call me Johnson because my name is Ben Johnson.
All right, Mr. Johnson. I came to know from the case note you came to here to remove a stitches. Is it right?
Yes, of course.
Okay. So along with you want to do the wound dressing as well as cleaning the wound. Is it right?
Yes, nurse, but I want to ask you something which is very important. The doctor has informed me that I had something called as squamous cell carcinoma. I don't know exactly what it is, but I believe that this is some kind of skin cancer or what. I'm a little bit worried about this name, nurse. What is it exactly? Can you inform me in detail?
Mr. Johnson, you don't worry about that. I can explain everything in detail. The squamous cell carcinoma is a type of skin cancer caused by sun exposure or ultraviolet radiation in excess wound. Is it clear with you?
Of course, yeah, I have a better understanding of what it is now, and I'd like to need. Uh, do I have to take participate in more surgery? Yeah, to remove other lesions in the future.
Yes, I can understand your concern. I assure you that your surgery is very effective and the lesions removed. Cancer unlikely to spread, but you need to do one important things. The pressure, the skin monitor is very much important for you. Checking for new changes, color change, or any spot, regular doctor checkup is very imperative for you to further prevention. Is it clear with you?
Yeah, of course, nurse, I can understand. And what are the reasons for this, nurse, and why I'm facing this problem?
Okay, that's a good question from your side. I'm glad to answer that. If you are exposed to sun or ultraviolet light, can cause this skin cancer. So, in order to that, you can prevent the more exposure to the sun and ultraviolet rays. Are you able to follow me?
Yes, nurse, of course.
Okay. I want to inform you if you have it when you are exposed to sun, you can use sunscreen, hat, etc. That will be very much helpful for you to avoid more exposure to the sun. Is it clear?
Yes, of course, nurse.
And continue to cover up and with the in sun and prevent of further damage. That is very vital for you to prevent further damage, further episode of skin cancer. Is it okay with you?
Yes, nurse. Actually, I want to tell you regarding what I do normally. I always wear a high factor sunscreen 30 or higher, and I wear a hat when I'm out in the sun. And but I think it's too late because the damage has already been there. And I spent too much time in the sun in my teenage years. Maybe this is the reason why I'm facing a problem.
Yes, I can understand your feelings, but continue to cover up when in sun. Prevention of further damage it can be done with the help of this protection. Is it clear?
Yes, nurse.
Okay. Do you have any pain or discharge from the surgical side?
Um, Yeah, actually, I don't have any pain or I don't have even any discharge. But don't you think it's too early to have the stitches out, nurse? Maybe they should be for some more time. Because and now onwards, I'll make sure to look after my skin.
Yes, with your permission, can I examine your cervical wound?
Yes, nurse, please.
Okay. Based on my examination, your surgical site is clean, and there is no discharge I noticed. So I emphasize for that reason we can remove the stitches now. The wound is clean and assessed by the doctor. So typically we used to remove the stitches 7 to 14 days. But in your case, the wound is cleaned, so we can remove the stitches at present. Is it okay with you?
Yes, nurse, of course, it's absolutely fine. And okay, I am ready to have the stitches removed. No problem. Is there anything else that I should know, nurse?
Okay, that's a reasonable question from your side. After the removing the sutures, I advise to keep the wound clean and covered, and always keep the wound dry. This was important to prevent infection and healing wound. Is it clear with you?
Yes, of course, nurse.
Okay, so would you please give the consent for to remove the stitches?
Yes, nurse, I am ready to sign the consent form. Thank you very much,
Okay.
nurse.
Thank you for the consent to remove the stitches. Now I will remove the stitches. Then I will cover your wound. If you need any doubt or concerns, this is my number. You can call me. I am here to help you. Take care. Thank you.
Yeah, that's very nice. Thank you very much, nurse.
Thank you. Welcome. Take care.
Yeah, now let me give you some feedback regarding what I have written for you. First one is, Jancy, you have some over excitement like that you are presenting. Over excitement that you want to do something like that. You want to show that it should be 100%, but it is more than that for you. So that little relax that one, that zooming yourself and be a little down, and you have to be a little confident rather than over excited. You have to be confident. See, for example, yeah, you should always have a smile on your face. Number one. So that means it shows that you are confident enough. Okay. That hurry or that hassle or that hurry or speed, you have to control that one a little. No need to talk very fast. See how I am talking. It's not what you are saying is important. How the other person is responding is more important. Not just to speak. So the other person to understand is more important. So that it should be a gradual process of speaking. The next one, you have used the word further 3 or 4 times. I don't know why you have used 3 or 4 times. Don't use that one. The next one, regarding fluency, your fluency is okay. Your fluency is okay. But the thing is, the flow of speech should not be very fast, should not be very slow. It can be slow, it can be average, and it can be fast, but not very fast and not very slow. Because if you speak very slowly, the people will wait for you and they lose their chain or connection. It should be in a flow. Then if you speak very fast, the listener cannot understand you. That's why you can speak slow or moderate or fast. Not very fast, not very slow. So intermediate range, that's you have to maintain. The next one is accuracy. Accuracy to a larger extent, you're not speaking something like specialized sentences. You're speaking ordinary sentences. So accuracy is well maintained. Maybe 80% accuracy is there, 85 also. But the thing is, quality level is just 40% or maybe 50%, even less than 50%, not more than 50%. Now, what is this quality? How can you make this quality improve? How can you improve this quality? So, for example, if you say, if you give me consent, then I will remove the stitches. So I want to remove your stitches. For that, I need your consent. So these two sentences you will join. For removing your stitches, I need your consent. Or if the consent is given, then the sutures can be removed. So you are writing speaking ordinary sentences, and you're also speaking active voice, not passive voice. You're saying, I will remove the sutures. Please give me your consent. If the consent is given, passive voice, the sutures can be removed. This is called quality. You understand? You are joining. See, actually, your sentence quality is 25% only. 25% only. Now, this 25%, these two sentences are joined into one sentence, it will become 50% quality. Then if you make it into passive voice, both of them passive voice, then it will be 100% quality. So, you please give me your consent. I will remove your sutures. So, two sentences. This is 25 marks you will get out of 100. Now, if you join these two sentences, if you give me consent, I can remove the sutures, or I can remove the sutures if you give me the consent. So joining these two sentences with if, then. Now, after that one, this you got 50 marks now out of 100. Now you change both these sentences into passive. If the consent is given, the sutures can be removed. So 100% quality. Many people don't know why they are losing their marks. They are just attempting only for 25%. They are attempting only for 25%. So how can they pass OET? So try to attempt at least for 50%. You can pass at least. But if you go for 100%, then you can get even A grade or B+. Is that clear?
Yes, sir.
And then next one is grammar. Grammar, you are sounding weak actually. Whatever you are speaking, that is fine. But the quality, variation in grammar, you're not using simple sentence, ordinary sentences you are using. You're not using simple sentences, you're not using complex sentences, you're not using compound sentence, you're not using complex or compound sentence or complex or complex sentence, or these different types of sentences you are not using. If you give a consent, if you give the consent, then the sutures can be removed, and therefore it is my humble request for you to provide the sign on the consent form as early as possible. See, 3 sentences joined into one mega sentence. Okay. So this is the way how you can. Then vocabulary. Vocabulary is also not of very high level. You're using. Don't use archaic words. But at least words, some words which are C1, C2. At least C1. You use the words which are better. Okay. So next one is pronunciation. Pronunciation is actually Indian accent. Okay. Right. But you can get a better pronunciation. You can improve your pronunciation by attempting some measures. Okay. Taking some measures. How? First of all, you take an audio where native people are speaking and repeat those sentences. Take 3 or 4 words. You cannot repeat everything because you don't remember everything. 2 things are there. You can take the audio and audio script, both in front of you. So audio will be playing and audio script will be there in front of you. So listen to the audio and repeat in the same manner along with him. First pass 3 or 4 words, after 3 or 4 words, and repeat. Pass, repeat, pass, play, repeat, pass, play, repeat, play, repeat, pass. Sorry, play, pass, repeat. Then again play, pass, repeat, play, pass, repeat. 3 or 4 words you can repeat like that. Then afterwards, what you do when you get good capability and you can understand, then what you can do is you can play the audio and you can keep the script in front of you And you can, they are speaking and you also speak along with them so that they go parallelly. So this is the way how you can improve your pronunciation. Next, flow of thought. Your flow of thought is average. That means the flow is not moving forward very fast pace. Okay, you're struggling in that area. Ideas are not developed fast at a faster pace. Subject knowledge you have, no doubt you have good subject knowledge, or you can, I can say better subject knowledge, but definitely it is not the best. But definitely it is not the best. Okay, so how you have to improve that one? See here. First and foremost, there is an urgent need to remove the sutures right now. On certain grounds. First and foremost, the wound healing is excellent. The wound healing process is excellent. The doctor has already assessed, and based on his recommendation, okay, normally the sutures will be removed after 7 to 14 days. If the recovery is faster, in 1 week, otherwise in a fortnight. Now this is very important. Now this is the reasons why we are removing the sutures now. It is very important. We should not delay. Now after removing the sutures, now there are some things which you have to take. This is called aftercare. You have to take some measures. Firstly, you have to keep the wound clean, covered, and dry. So like this, you have to speak. Is that clear?
Yes, sir.
Okay, now tell me, give me your feedback. What did you learn today?
Well, actually, my speed is little high. I have to be slowed down to understand the opposite person.
Okay. Okay. Were
I
the
need to
suggestions
improve my
good for you?
vocabulary. Yes, of course, sir. Of course. Whatever you are telling for my improvement, no. So
Maybe
next is
you will be thinking
fluency.
nobody is
Fluency
telling this
also I
many
need
corrections.
to.
Why are you telling these many corrections, sir?
No, sir. You only tell this much corrections so that I can improve. So vocabulary I need to improve. Fluency I need to improve. My speed has to reduce. So these all things I understood.
Okay, that's very nice. Thank you very much.
Thank you, sir, for your valuable